Well, we're all very aware of our AFLers and other professional athletes having troubles with their knees. The fact is, knee problems are very common through childhood and adolescence. The first injury that we would all think of with the knee would be an ACL rupture. The children can have an ACL rupture, but more commonly the ACL will pull off a piece of the tibia bone called a tibial spine fracture. The good news about this is that this responds to surgical management much quicker than an ACL rupture. Other conditions that adults get, children can get too, and that includes tears of the meniscus. The one abnormality that we see with children, though, is that on the lateral meniscus, instead of it being in a nice C shape, it will be a complete disc, which allows it not to move as well as we want and can get caught and cause a tear. So even children as young as 5 or 6 years old can have meniscal tears. We'd be suspicious of that if they were complaining of pain along the medial or lateral aspect of the knee and getting episodes of the knee giving way. The best way to make the diagnosis would be to see your GP or physio and then proceeding with an MRI, which will tell us what's going on inside the knee. Another very common problem for us to see as pediatric orthopedic surgeons is a condition called Osteochondritis dissecans, OCD. Now it can mimic a meniscal tear, as the child will have episodes of the knee giving way, getting discomfort, swelling. But instead of something being wrong with the meniscus, the area of the bone just under the joint loses its blood supply. When that happens, that piece of bone dies and then indeed can be unstable and even can become a loose body in the joint. The child's symptoms will consist of recurrent pain, giving way, and swelling. The diagnosis can be made through X-ray and MRI. Management often consists of a simple surgical procedure to drill the OCD lesion and improve the blood supply, although sometimes more involved surgery to stabilize the piece is necessary. Patellofemoral problems are very common as children go through adolescence. This varies from the patella just sitting not quite in central and then going up and down and just not sitting right, which gives discomfort, all the way to the malalignment being so much that the patella actually dislocates. The hallmark of treatment with patellofemoral problems is working hard with your physiotherapist. However, if the patella keeps dislocating, it may well need surgical intervention. The bottom line with all these knee problems is there really is nothing that can't be taken care of, but observation to your child's pain and symptoms and follow up with your family doctor and physiotherapist is essential.